In this video, I want to talk about drugs to treat anxiety and anxiety-related disorders. So just as a brief introduction, there are many anxiety and anxiety-related disorders, but what is anxiety? Well, it's the body's natural response to stress. And that's a good thing because we want to be aroused, we want to be vigilant, we want to have fear. It actually enhances survival. But too much or too little can be a problem. We're talking about disorders with too much anxiety, and some that I just want to mention because they're fairly common is GAD, which stands for generalized anxiety disorder, so anxiety and worry about everyday things that leads to impairment of functioning. Social anxiety disorder, which is more in a social environment, so being very worried about judgment of other people and then avoiding any social environment. A panic disorder, very common if you have unexpected or recurrent panic attacks, and I'm sure everybody knows how a panic attack may feel. So you start sweating, your heart races, you feel dizzy. And if you have those without knowing when they're going to come, that's obviously a situation where you could be diagnosed with panic disorder. So we're going to discuss some drugs that are going to be helpful for all the different anxiety and related disorders. What are drugs that we can use to treat anxiety and related disorders? Well, first-line drugs are the SSRIs. So they are used fairly common for anxiety and related disorders. Also, SNRIs can be used. To a certain extent, not a very broad indication, but some TCAs are used. So these are all our antidepressants that we have discussed in another video. Then something very important option for anxiety-related disorders are the benzodiazepines. Now, we're also going to discuss benzodiazepines in the video on insomnia, but I think you all know that benzodiazepines have, besides their hypnotic and sedative effects, anxiolytic effects. So that's a good thing, but benzos have big problems in substance use disorders. So that's not really a long-term action. However, if you remember all these antidepressants here, they're not going to act immediately. So what are you going to do when you have someone in your office with an acute panic attack? Well, that's going to take a couple of weeks to kick in. Well, then you're going to use the benzos. So the benzos are the only drugs that we have for anxiety and anxiety-related disorders that work immediately. So they're a very good option if you need immediate treatment. And actually what is done a lot of times, because SSRIs are first line, you're going to start with both, that you have something that kicks in immediately, taper the benzos off, and then hopefully once you taper the benzos off, at that point the SSRI has kicked in. So that's a general option. And then we have one other drug that's called buspirone, and that's a special drug in a way because, as you can see already here, all these drugs have many other uses. They're not just going to come up here in this anxiety section, but buspirone is only going to come up in this anxiety section. It's only approved for GAD, generalized anxiety disorder, but it's not a great drug, but it's just special in a way because it has only this one indication and has also a fairly unique mechanism of action. Now I want to say a couple of words for all of the different classes. So we're going to start with the SSRIs. Again, we're going to discuss them in the antidepressant section. They are the agents of choice in long-term treatment. Sometimes you could also use an SNRI or a TCA. Now for the benzos. Benzodiazepines, these are all the drugs that end in PAM and LAM, like alprazolam, diazepam. And these are the ones that act at this GABA A receptor, the major inhibitory receptor of our nervous system. And in addition to the hypnotic sedative effect, they have also anxiolytic effects. The good thing about them, again, is they are effective immediately. You can't use them for a long term. You can only use them for very short term, so about 2 weeks, because they cause dependence. And again, I'm going to discuss this in another video. The major uses for them is to be used while waiting till the effect of the SSRI is going to kick in. Not all the benzos are approved for every single anxiety disorder, but I'm going to leave that up to you to figure out also in your practice. That would be quite a lot to expect from someone in their preclinical years to know. Then a couple of words about the drug buspirone. This is a partial agonist at a serotonin receptor, the 5-HT1A receptor. This seems to have anxiolytic effects if you stimulate it. It's partially stimulated, so not full stimulated. Adverse effects, some dizziness, and then some non-specific chest pain has happened. So people thought they have a heart attack. So that's something you may want to mention to your patient. It's also not effective immediately, most effective after 1 to 4 weeks. And now it has a minimal abuse liability, which is an advantage compared to the benzos. But it's definitively not a drug that works great. You're not going to see it a lot around. It's just a special drug because this has only the indication of anxiety, whereas all the other drugs have additional uses, and that's why I think the boards like to test buspirone. This finishes the video on drugs to treat anxiety and related disorders. Thanks for watching. Bye bye.